Dr. Badia here with the next installation about Chapter 9, The Big Business of Health Insurance, from the book Healthcare from the Trenches. So somehow health insurance has been equated with healthcare, which myself and other providers think is really a travesty. It's a necessary evil of our society, insurance, much like death and taxes, but it's got a little out of control, where we're almost dominated by the paperwork in order to be able to get reimbursed for the vital service we deliver. This is what they call an EOB, explanation of benefits. Basically, at the end it says I'm being paid zero for these surgeries I actually did. I have proof that I did them, but you have to play this game. And this is driving up the cost of healthcare because we need to get together and talk about how to solve these, because we understand that insurance is something that's going to be around. There's a section in here entitled Authorization is a 4-letter word. It's because it's really a ridiculous concept when you think about the fact that somebody who has many years of training should be the best person to decide if something is needed, is medically necessary, not somebody sitting at a desk. That doesn't mean that we don't need oversight. And I think most clinicians would agree that there are always outliers and we need to make sure. But every step of the way is multiple hurdles and obstacles for us to be able to deliver care. There's testimony here from different therapists, physical therapists, occupational therapists, patients. The patient weighs in on what they went through to get care. There's a wonderful restaurant analogy. What if restaurants were run like healthcare, where you'd walk in and if you wanted a salad, you'd need to get a authorization beforehand, and if you wanted salt and pepper with that, you might have to pay extra. It shows the absurdity of the process. And finally, work comp. Work comp is essentially insurance for injured workers. As a hand surgeon, this is something that I do a lot of, and I enjoy doing it. I enjoy getting people back to their livelihood. But the obstacles have gotten way out of control, and that is driving up the cost of our healthcare system. And the public needs to notice, legislators need to notice, and we need to coalesce to really bring solution to a vexing problem that's now affecting 20% of our country's GDP.